Hello, and thank you for checking in to our ACANY and Life Plans virtual learning session for March 19th, 2026. This is Positive Psychology Part 2, and this is our third session on supporting others with strength and positivity. In this session, we explore how positive psychology can be used as a practical, compassionate framework for supporting children and families, especially when things aren't going well. Rather than focusing only on challenging behaviors, this training emphasizes understanding the why behind distress, identifying strengths, and building resilience over time. Grounded in the PERMA model, PERMA stands for Positive Emotions, Engagement, Relationships, Meaning, and Accomplishment. The session offers concrete strategies parents and caregivers can use at home to reduce crises, improve emotional regulation, and strengthen connection. This recording is especially relevant for families of children with autism and other intellectual or developmental disabilities, highlighting how unmet physical, emotional, social, or environmental needs often show up as behavior. Throughout the session, viewers are encouraged to look beyond surface-level behaviors, rule out medical concerns, and use strengths-based approaches to help children feel safer, more understood, and more capable of coping with life's challenges. We welcome licensed clinical social worker Chelsea Shepard.
Hi, everyone. Thank you so much for being here today. I'm so excited for our third and final training on positive psychology. So I'm just going to kind of dive in. There we go. So just as a refresher, positive psychology is not to be confused with toxic positivity. It's not just telling people to look on the bright side when things aren't going well. It was really developed as a challenge to the traditional mental health and psychiatric model, which viewed mental health as solely a medical condition. But now that we have been doing this for a lot longer, we kind of understand better that mental health is a biological, psychological, and social problem. If you, and this is true of some of the people that I support, if you have a family of 6 living in a one-room apartment and you don't have any money and you're really stressed out, just an antidepressant alone is not going to help you feel better because there's serious social components to why you're not feeling well. So the goal of positive psychology is to look at the whole picture and view people through their strengths. A lot of the time when people aren't doing well, they hear about it, right? As parents, you might hear from the school a lot, the so-and-so is doing this wrong and they're having a hard time with this. And, it's important to notice when things aren't going right, but it's just as important to notice when things are going right. Because otherwise people get discouraged. And when we're discouraged, we're less likely to try to do what we have to do to get better. And so the way that we kind of look at positive psychology is through this, I really call it a formula for the components of life that we need in order to feel well and happy. And that formula is called PERMA. So PERMA includes positive emotions, engagement, relationships, meaning, and accomplishment. And last time we really took a deep dive into PERMA and what all of that really means. So today we're not going to do that because we already did it, but we're going to look at how to then use positive psychology when things aren't going right. And the goal of PERMA really is to help us identify the why. And we do that a lot in my program at Start. People come into us, most of our referrals look the same. So-and-so is aggressive. So-and-so is non-compliant. They're hitting their head against the wall. They're screaming and throwing themselves to the floor and hitting other people. But the why is very different in a lot of different cases. And I think we talked about this last time, but think about the headache. A headache is a headache, right? It's pain in your head. But there's so many different kinds of headaches. Like there's headaches that you wouldn't have ever even thought of. And there's so many reasons for having headaches. Maybe we're not drinking enough water. Maybe we're stressed. Maybe when we're exercising, we're not, you know, activating our core in the right way. Maybe it's neurological. So we can try to take medicine to treat our headache in that moment. But it's really important to know, why are we having a headache? Some headaches are pretty benign and some are actually really serious and could be life-threatening. And so, you know, it can be the same with any kind of problem that we're having, whether it's physical or emotional. We need to know why, in order to help somebody feel better. So why might somebody be in crisis? And this is not a comprehensive list. There's infinite reasons why somebody might be upset. But I've been doing this for a long time, and this is the pattern that I've seen. I don't know if any of you have heard the word hangry. But I spend a lot of time talking about being hangry. People with neurodevelopmental differences and especially autism spectrum disorder, they have interoceptive differences, right? So they don't always recognize their physiological needs. So we might have to really help our kids be aware of, okay, it's been a long time since you ate last. Why don't we try eating something? So in the short term, being hungry and being cranky can lead to low blood sugar and low blood pressure. And then in the long term, you know, if we're not eating right, we can become obese. That can come with other medical complications. And people who are pre-diabetic or have type 2 diabetes are even more likely to become irritable when they are hungry. And then there's malnutrition, and we see that in a lot of people with autism, right? They're picky. They're really, really picky. Some people are even beyond picky and they have eating disorders. Not the traditional ones, but something called ARFID, where they really only eat a couple of foods. So picky eaters can get vitamin deficiencies. They can have vitamin D deficiency, which really happens when you don't go out in the sun enough. A lot of foods are actually fortified with vitamin D now, which is great. But vitamin D deficiency can feel like depression or anxiety, and it can increase agitation. Anemia is another one. That means you're not getting enough iron. People who have anemia feel really fatigued and irritable. And it's not uncommon with picky eaters, especially young women. And malnutrition can, in rare cases, lead to serious medical disorders like kidney disease. Sleep. This is a huge one. About 50 to 80% of children with autism spectrum disorder experience poor sleep. I'm sure that as parents, you have seen this and can confirm it to be true. People with autism are more likely to have difficulty falling asleep, staying asleep, or have a poor quality of sleep. So it might look like they're sleeping, but they're not entering the REM cycle properly and sufficiently to wake up feeling rested. And now in today's modern age, screen time makes this worse. And I'm guilty of this myself. You know, I know that I should put my phone down like 30 minutes before bedtime. I don't do it. You know, I think a lot of us are guilty of like doom scrolling as we are trying to go to sleep. But it makes falling asleep a lot harder, and it makes the quality of our sleep worse. And the same is true for our children. And so it's really, really, really important to create a bedtime routine and stick to it. And it can feel torturous at times. But sometimes doing this slog and suffering for a few months until we get kind of into that routine, and maybe a few months is really a few years. But we're building really important habits that your children are going to have throughout their lives. And so a bedtime routine might look a little bit different in everybody's own individual family. And I encourage adults to do this as well. Try to go to bed at the same time every night. Have a wind down time that's away from screens. For people with autism and intellectual disabilities, sometimes doing things in the same order every night can be really helpful and soothing. So if we usually brush our teeth first and then wash our face, do it in that order. Every night, you can even have a visual prompt on the wall. And then a relaxation activity in bed, especially for the younger kids, whether it's reading a story, praying, taking deep breaths, practicing gratitude, what are you grateful for? And then lights out. Again, try to do it around the same time every night. Medical needs, constipation, constipation, constipation. At START, we work with people who are in severe psychiatric crisis, and we work with some of the most challenging cases in New York City. And I cannot tell you how many of the most challenging cases in New York City this year were in crisis. We're doing really, really dangerous, scary things, and it turns out they were constipated. People with intellectual disabilities have anatomical differences that make them more likely to become constipated. They're also less likely to drink water because they don't always recognize that they're thirsty. That pickiness means that they might be eating less fiber. And a lot of people with autism spectrum disorder and intellectual disabilities, they might not have, the same muscle mass that other people have. And so they might not want to exercise as much. So all these things make you more likely to be constipated. Sometimes people with intellectual disabilities feel like their abdomen is soft upon physical examination, but they're still constipated. Psychiatric medications very often make you more constipated. So I always try to impress this on everybody. Pay attention to someone's bowel movements. And I know it's gross, and I know we don't want to do it. But it's so important. I cannot tell you how important it is. Um, and then, if someone's not doing well suddenly and it's not what we call their baseline, all of a sudden they're getting more upset than usual and it's been going on for a little while, get a medical appointment. Always rule out medical first. Talk to the pediatrician, rule out vitamin deficiencies. Maybe they haven't been eating as much red meat lately or eggs. Always make sure that, the first thing that you do is talk to the medical doctor. Make sure that they're not constipated. Another common medical condition that we see is GERD. Again, people with intellectual disabilities tend to be on more medications that could give you GERD. Sour stomach is really uncomfortable. People with IDD have a hard time reporting that they're feeling stomach pain, and it gets missed. I don't have the statistics in front of me, but there's an overrepresentation of people with neurodevelopmental disabilities who have epilepsy. So, if somebody's acting really strange or seemingly out of nowhere, talk to your doctor about possible seizure disorders. And assess for pain. Dental's another big one. We had somebody who was in crisis often, and the system was saying he needs different psychiatric medication. He needs different psychiatric medication. He needs an inpatient admission. He had a ton of cavities and he was in pain. But people who have fewer words or a harder time expressing themselves will tell us that something's wrong in their behavior. And so even though this person had dental pain, or some people might have headaches or feel constipated, they don't know how to express that. Even people who are fully verbal and can speak in full sentences, again, they have interoceptive differences and they might not recognize that they're feeling pain. And so instead they just get agitated and they tell us by being really cranky or by throwing things in the house or by screaming. And it can be really frustrating and we want to pull our hair out of our head. But really what we need to do is pay more attention to medical needs. And sometimes that takes a lot of advocacy from parents towards your doctor. And Lastly, I can't impress on you enough, even if somebody is not sexually active and may never become sexually active, if your child has a uterus, once they reach, I don't know which age it's supposed to be, maybe 12-ish, they should see a gynecologist. There's a lot of gynecological issues that are overrepresented in people with autism and intellectual disabilities that have nothing to do with romantic relationships. Fibroids, PCOS, premenstrual dysphoric disorder, which is like really bad PMS. All these challenges are overrepresented in people with intellectual disabilities. So please, 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 please take your daughters to see a gynecologist. So how do we help people express their needs when they're having a hard time, right? Utilize an iPad or a visual exchange board. And again, meet with the doctor and let them know something weird is going on and I'm not sure what it is. Can we, talk to a nutritionist? Can we meet with a speech therapist or get a referral? A lot of kids get that in school. So maybe have a meeting with a speech language pathologist at school to see, how can we use those same strategies at home. Um, most doctors' offices don't have these, but that doesn't mean that you can't use it at home. A lot of this kind of thing is available to print off for free online. What is hurting? Sometimes taking the language out of it and just using pictures can be really helpful. It'll help people identify what's wrong, and it'll help people try to think about identifying it to themselves, right? Reproduction, it's an uncomfortable topic, but again, it's an important one. Unmet sexual needs. Again, I think it's really confusing and hard for families sometimes because you might have a teenage boy who's your son and he loves SpongeBob, but his body is still the body of a teenage boy. And so there's sometimes a mismatch between personality and physiological feelings. So it's really important to still provide, developmentally appropriate conversations with your teenagers so that they know what's going on with their bodies. Just because, somebody might not really understand what it means to have a romantic partner doesn't mean that they don't want one. And so what does a safe relationship look like for that person? How can they approach somebody that they kind of have a crush on? It's really important to have these conversations with your kids so that they're getting the information from you and not looking it up on the internet or just sitting in the dark and thinking like, oh my gosh, something new is happening to me and I don't know what it is. That's really stressful. And I think it's important to acknowledge too that maybe sometimes people with intellectual disabilities aren't going to have the family that they want to have. I mean, I still support, trying to find a way to help people have romantic relationships in the context that's appropriate for them. But that might not look like getting married and having kids and living in a house, right? So acknowledging that that can be a huge sense of loss for people is really important. And I'm going to say it again. Everyone who has a uterus should see a gynecologist. And trauma, and we don't want to think that that happens to our own kids, but I think it's worth mentioning, and I'm not trying to scare you, that people with intellectual disabilities are more likely to experience trauma. And so that might not be the case with your children, and I hope that it's not. But it's also important because your kids are gonna, potentially end up in a school or a day hub as they get older with people who might have experienced this. And so, people with intellectual disabilities are more likely to experience trauma. People with intellectual disabilities are also more likely to feel traumatized by those kind of lowercase t's. So, moving schools, parents' divorce, um, your favorite teacher leaves halfway through the year because for whatever reason. That can be really, really hard for people who really need that routine and that sameness. I mean, divorce is super traumatizing for everyone. Um, so I think it's important to consider like, yes, okay, this person, everyone loses a grandparent, right? But it might impact your children a lot more than it would a neurotypical child. Um, so again, your kids might not experience those big T's. I sure hope not, right? But those little T's can be very impactful for somebody with a intellectual disability. Bullying, that's a huge one. A lot of people who are referred to my program experienced bullying in school. Now they do not want to go back, right? And bullying is unfortunately really common for kids, but it can be devastating. I mean, it's devastating for all kids, but it's really devastating for people with intellectual disabilities. Breakups, same thing, I mean, we might think of like a sixth grade breakup as, this silly part of life, but it can be devastating to a child when they're experiencing it. Parents not getting along, we're all human. Sometimes we fight with our partners, right? But it can be really, really impactful for people with children with intellectual disabilities. So how do we help if somebody is going through something like this? If your child is being bullied and now all of a sudden they're acting out at home, or if you and your spouse are separating and there's a huge behavioral change in your child, what can you do? Respect individual autonomy as much as possible and within reason. So that doesn't mean let them do whatever they want, right? Like our job as parents is to keep our kids safe. Um, but instead of saying no, we try to encourage people offer two choices, right? Offer two choices as much as possible. Let them decide what we're having for dinner tonight out of those two choices. If they don't want to go to school today, one idea is if they don't want to do something, say, do you want to do it now or do you want to do it 2 minutes from now? And set a timer. And then when the timer goes off, encourage them again. I'm not saying it's going to work every single time because the timer might go off and they might say, no, I still say no. But it's giving them a sense of autonomy that they're choosing when to do something. Use I feel language instead of you always or you never. This is a big one. This is something that like therapists encourage a lot in interpersonal relationship therapy as well. When you're talking to your partner. So, I encourage everyone to use this within their whole family. But instead of saying, you never clean up after yourself after dinner, you could say, I feel frustrated when we leave things messy after dinner. Acknowledge their feelings, even if you don't agree. That doesn't mean saying, okay, you're right, we should never go to school and we should only eat cookies. But you could say, I hear you when you say you don't want to eat dinner and you just want to eat dessert. That is really frustrating. Unfortunately, we have to eat nutrition and nutritious food. But I hear you that it's not what you want to eat. Be consistent. This one is so hard because some days you're going to have more energy than others. And again, we're all humans. Sometimes we're busy and sometimes we're not. And sometimes we're like, I'm going to be a super mom today. And then the next day you get a head cold and your kid's sneezing in your face and you can't be a super mom every day, but be as consistent as you can. Identify the things like bedtime where okay, like this is what I'm going to prioritize, what I'm consistent about. Maybe the house might get a little messy sometimes because I get really tired, but I'm always going to make sure that they're in bed at 8 p.m. Create a calming environment, dim the lights, relaxing music, keep the house as zen as possible. I know sometimes people with autism, like they're really sensitive to other people's noises. And then when they're watching their favorite show or listening to music, they want the volume up to 100. But try your best to keep it zen and calm at home. And again, I think we really talked about this a lot in our first training, model calmness. And we're human, and sometimes we're going to get frustrated and we're just going to yell. It's just part of being a human being in this world. But again, this is all about like doing our best and trying to get better. So really try to be calm, try to take your own deep breaths, right? Try to model taking deep breaths and model using those coping skills. And, the days that you can't do it and you really get frustrated and yell back, process afterwards and say, you're right, I shouldn't have done that. I shouldn't yell. I just feel frustrated when you're not listening, or when you're having a hard time, I have a hard time. But I want to do better together. And then help identify those triggers before a crisis as much as possible. If you know that there's always going to be a crisis when we turn off the screens, let them know, hey, I know turning the TV off can be really hard, so we're going to do this in 10 minutes. What can I do to help you calm when it's time to say goodbye to the television? Love and belonging. People who have developmental disabilities are more likely to feel lonely. For a long time, there was this thought that people with intellectual disabilities, and especially autism, don't seek out relationships because interpersonal relationships aren't important to them. But we've come a long way in our understanding since then. And now we understand much better that people with autism, it's not that they don't seek out relationships because they don't want them. It's that they don't know how. They don't have that intuitive, like, I'm witnessing as a baby, people interact with each other. And so therefore I'm understanding now how to pick up on social cues and how to initiate conversation and how to keep it appropriate. People with autism, they have a hard time reading those nonverbal social communications. So they don't necessarily remember that not everyone wants to talk about trains for 2 hours, right? It has to be a back and forth. So they need a lot more support, but it doesn't mean that they don't want those relationships. And so sometimes they just need a lot more coaching. Things that might be intuitive to us might not be intuitive to them. And it's going to take a lot of repetition before it really sinks in. But recognizing, that everyone is deserving of love. And I'm sure that you know that about your kids already. But they're deserving of love outside of their family too. And so how can we help foster those relationships? And recognizing that sometimes if our kids all of a sudden this year, they're just not acting themselves and they're a lot more irritable, they actually might be depressed. There's a separate diagnostic manual for people with neurodevelopmental disabilities and mental illness, and it highlights that irritability can be a primary symptom of depression for people with intellectual disabilities. So, somebody might seem to us as like, oh, all of a sudden they're cranky all the time, but it's important to consider depression if it's been going on for 2 or more months. We kind of talked about this last time. So how do we use positive psychology at home to decrease crises? So first, I think we provided the website last time, but I can do that again. There's actually a free test that you can take online that tells you what your signature strengths are. You just have to give them your email address. Um, I think that my signature strengths were humor and appreciation of beauty. And so it ranks your strengths, like all 24 of them from first to last. They don't say worst strength or weakness, but they say least great strength. So my least great strength is forgiveness, which my husband thinks is hilarious, and he would probably agree with that. But there's a way that you can really look it up. And so the reason that we look at somebody's strengths is A, so that we can compliment them, right? That's really important. But B, when we're thinking about how to help somebody um, change their behavior so that we can, change how they feel so that they feel good, we want to do it using the things that they're already good at. Um, you know, some kids tend to be better at math and some kids tend to be better at math. Oh, I said math, excuse me, at reading, right? And some kids are better at sports and some kids are better at singing. Everybody is just kind of naturally better at certain things and naturally, needs to work harder to get good at other things. And so the same is true with our virtues. Some people are more creative. Some people have more zest, which means like being really positive and enthusiastic and energetic. Some people have more hope. It's easier to feel hopeful. Some people, are natural pessimists. So we're not going to ask someone who's naturally really pessimistic to try to use their hope to overcome something. I'm kind of like that. If I'm upset and somebody tells me to look on the bright side of things, that makes me more mad. um, because I feel like how I'm feeling is being dismissed. Um, but some people, that's really helpful. For some people, they just need that little piece of perspective to remind themselves that really, in the grand scheme of things, what they're going through is really small. And they hear, like, look on the bright side and things could be way worse, and it helps them feel better. So it really depends on if that person's strength is hope or not. And there's kind of 6 categories within those subcategories. So there's wisdom and knowledge, there's courage, there's justice, there's humanity, there's temperance, and there's transcendence. So there's a lot of different ways that people can demonstrate their strengths. And so when we lack strengths in certain areas, that's when we might see crises or things that we don't like to see, right? When people have a strength of justice and things aren't going well for them, they might self-sabotage. Or they might be compliant in things that maybe they shouldn't be compliant in. When somebody's strength is love and things are going well, you might see them be kind and be able to have intimacy with other people, feel that social connection. And then when things aren't going well for somebody who has a strength of love, you might see them be cruel. And you might think to yourself, that's not my child. My child's not a bully. But it's because they're feeling an absence of love, right? Lots of kids are bullies because they're not feeling loved themselves. And it's not because their parents aren't loving them. It could come from anywhere. But really it comes from unhappiness and lack of PERMA. If somebody's strength is courage, when they're doing well and things, their PERMA is fulfilled, we might see them be brave and persistent. This might be somebody who doesn't give up on their dreams. And then when things aren't doing well, we might see them look helpless or even lifeless. And we might think, like, that's not my kid. My kid's the one who's going to climb to the tallest piece of equipment at the playground and drive me crazy. But it's because their PERMA is not being fulfilled right now. So the goal of positive psychology is to increase resilience. The ability to grow and thrive in the face of challenge and bounce back for adversity. So, we talked earlier about those little T traumas and how they can be a lot more devastating for people who are neurodevelopmentally different. So the goal of positive psychology within the neurodevelopmental model is to help people feel stronger when things don't go well. How can I help my child? Bullying, unfortunately, like I think society cares about bullying a lot more than they used to, which is great. I know when I was growing up, it was like if you're being bullied, suck it up. And schools take it a lot more seriously now. So, yay, that's huge progress. But kids are mean. Kids are still learning to develop their empathy. And, sometimes they do that by practicing and by being mean and seeing that it makes the other person feel sad. And so then they learn to not do it anymore. But bullying happens, right? So, how can we help our kids to be more resilient in the face of adversity, whether it's bullying? Everybody loses someone eventually, right? We all get older. So whether it's losing a grandparent, whether it's a friend moving away, how can we help our kids so that it's less devastating? So resilience requires coping skills, right? So, being able to be upset without it turning into a big crisis or a tantrum or an unsafe situation. Resilience requires a realistic assessment of obstacles, and that can be really hard for somebody who has an intellectual disability because they can't always conceptualize things realistically. So that's where, as parents, we might come in and say, okay, let's break this obstacle down into little steps and try to look at it in a different way. Resilience requires articulating a desired future. So, you're being bullied at school. What do you want to happen to you instead? And how can we get there? Resilience is best regarded as something that one does rather than something that you are. Resilience, we are, for a long time, like there was this thing that came out, and I think it was originally from the military. Do you have grit? Are you someone with grit? Some people naturally have grit, and some people don't naturally have grit. And so that's one school of thought that sounds very malicious to me. But for me, in mental health, self-regulation might be a strength for some people and might be not so much a strength for other people, but it is something that everybody can do and practice. Math is not my strength, right? But if I practice enough, I can get it and I can do the equation too. It's math isn't who you are. And so the same with resilience. Resilience is something that we have to practice. It's not a crash diet. It's not, oh, well, Chelsea gave me these interventions and I tried them for a couple days and nothing happened. Resilience means trying every single day to build up these skills. And it is not easy. I think I say that constantly in all the trainings that I do, but it's because, I think it's really easy to say a lot of this stuff and it's so hard to implement. And it's so hard to be patient and it's so hard to come home from work. And today was extra long and I didn't sleep last night and no one in the house slept. And I just want to put the TV on and like not deal with anything. So I get it, but this is why, acknowledge your own humanity, be kind to yourself, be forgiving, but try to pick a couple things that are non-negotiable. And I really encourage bedtime routine to be one of them. And these habits that you help your children cultivate is going to help them throughout their entire lives. So we want to help kids become more self-aware. That's really hard sometimes for people with autism. So we want them to be self-aware, self-regulation. They can need a lot of prompting for that. Optimism, that's not my strength, but I can practice it. Mental agility, again, that can be really hard, but thinking flexibly. If we don't practice our flexibility muscle, then we're going to get out of practice and we're going to become more rigid. And that's something that we see a lot of the people that I support. Those character strengths that we already spoke about, and connection to role models outside of the family. No one is ever going to replace mom and dad. but it's really important for our children's social safety net to grow outside of that, for them to have connections with role models, for them to have friends. Even a hill is less steep if you're with a friend, right? If we go into life thinking, I can't do this, I'm disabled, there's nothing I can do, then we're not even going to try. We're limiting ourselves. And so, yes, every single human being on this planet has limitations. Like, I can't just jump off my roof and fly. But it's also really important to have hope for ourselves and for our kids to have hopes for themselves, so that they push forward. So we want to make sure that we start to recognize our kids' skills. What are they good at? Are they really good at complimenting other people? It sounds like they're really kind. Are they always, sometimes we have kids who I try to reframe it. So kids who are always saying, no, I don't want that, I want this. Try to think of that as, okay, this person is a really strong self-advocate. That is their strength. It can also be a deficit, right? Because it means that they're less likely to listen to me. But if they're a strong self-advocate, then how can I use their self-advocacy to help them help themselves? Instead of always saying, no, 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 do it my way, how can we say, all right, what are your goals? Let's work together to think about how we can accomplish those goals. And then we can do things your way, but that's in a way that's safe, right? So kind of meeting them in the middle. So I encourage you to also use that VIA Character Strength website. It's free, to help you recognize what somebody's strengths might be. If someone's strength is gratitude, try using a gratitude journal. If someone's top strength is appreciation of beauty, like mine, explore mindfulness walks. That means that they get calm by their surroundings. So that would be a good opportunity to exercise that strength. Identify gaps in PERMA when developing treatment goals. So your parents, you're not necessarily going to develop a treatment goal. But again, if someone's upset, try to help figure out why. Why is this happening? Is it because they're being bullied? Is it because all of a sudden, their favorite teacher is gone from school? Have their other parent and I have been fighting a little bit too much in front of them? Once we kind of identify the why, and maybe they're not pooping. It's really, really, really common. So once we figure out that why, we can try to work towards stability. And you don't have to do it alone, right? You can take them to their medical doctor. You can take them to a therapist and say, listen, my son or daughter is not acting like themselves. This isn't like them. How can I figure out what's going on so we can help them get better? Ask your kids about their hopes and dreams. I'm sure that the people on this call are already doing that in a really wonderful way, but traditionally, many years ago, society didn't think that kids with neurodevelopmental differences had hopes and dreams, and we now know that that's crazy. And sometimes our kids' hopes and dreams aren't necessarily realistic, and part of that is age appropriate. Like, not every single person who wants to be a rapper is going to be the next Dr. Dre. But if somebody wants to be a famous rapper, then how can we give them opportunities to utilize music in their lives, in a way that's calming and soothing, and makes them feel like their PERMA is fulfilled, even if they don't end up becoming famous? Right now, at least they're doing something along the lines of what they want. Every so often we get somebody who's like 16, 15, and they say, like, I want to have a baby. I want to have a baby right now. That's not safe, right? That's not a good idea. So, when you're using positive psychology, you're not going to just say, all right, green flag, like, go forth and have a baby. But we can say, okay, this person really cares about being a nurturer. What are some other ways that we can help them nurture? Can we have them get some pet therapy? Or volunteer, depending on their age and skill set, at a shelter for animals? Can we help them grow some flowers? There's so many different ways to nurture. Can we help them have a relationship with a niece or a nephew in a different way? How can we use their wish to kind of fill a hole in their lives, even if it's not going to be in the exact way that they're wanting? Strength spotting. So this one's really important. When people are having a hard time, again, they hear about it a lot. And you as parents hear about it a lot. The schools might call you multiple times a week and say, oh, little Johnny did this again. Little Johnny did that again. And that's really discouraging. That's discouraging for your kids, and it's discouraging for you as parents. So one thing that we at START really recommend that schools and day habs do in this kind of situation is schedule a call once a week with the families to let them know all the things that that child did correct. Everything that they're doing great. All the times when they could have gone into crisis or could have had a tantrum and they didn't. All the times that they were kind. And what that does is two things. One, as parents, you feel better. You feel like they care about your child and they recognize that they're not all bad, right? And B, it forces the teacher to look for those good things, right? It forces the teachers or, whatever provider to look for the times that little Johnny is kind. Look for the times when little Johnny could have had a crisis but didn't and used their coping skills. And then everybody is kind of reframing that person in terms of their strengths. And it doesn't mean that we're saying, okay, have as many tantrums as you want. Good job. But it's also important to consider the times that things go right. Because how can we increase those to decrease the times that things don't go right? So when you're strength spotting your own children, and you can do this not just with your kids, you can do it with your spouse. I highly recommend it. Or even if you're not together with your kids' parents, you can still do it to foster that positive co-parenting relationship. You can do this with anyone, really. It motivates people to do that thing again when it's recognized as being good, right? If your eldest child does the laundry, like praise the crap out of them for it so that they want to do the laundry again. So how do we strength spot? We label the strength that you notice. Explain why you think it was so great, and then appreciate it. And some affirmation. So instead of just saying, good job, you did it, really break it down. I saw that other child grabbed something out of your hand and you looked the other way. That was really amazing. I know that that's not easy for you to do. I'm really proud of you. So we want to be as specific as we can, to let them know exactly what it is that they're doing right so that they know for next time. And this one is my favorite. Sometimes people ask me, like, if you could just pick one tool to use, what would it be? Definitely active constructive responding. I think it might have, I forget if it was our first training or our second training, but we talked about the positivity ratio and how we need 3 times more positivity to drown out that negativity. And I personally think it's more, because I can have people say like 10 nice things to me, and then if I hear one negative comment, like my whole day is ruined. So we need a lot of positivity, right, to drown out that negativity. And so if someone's being bullied at school, or someone's bullying themselves, right, because they don't have good self-esteem, we want to help drown that out for our kids. So active constructive responding is a way to be overly enthusiastic. It can feel like too much sometimes, but it's not received that way. So if somebody tells you, oh, I got a good grade on my math test today. Like, that's the best news that you've ever heard in your life. Like, you have to be so, so excited. Your child draws a rainbow. Like, that's the most beautiful rainbow that you've ever seen. You really just want to be as positive and enthusiastic as possible so that your kids feel like, yeah, like my parents don't let me do whatever I want, but they are my biggest champion. Take the emotional temperature. And so this is a worksheet. I could maybe send the worksheet out when we send out the slides so that parents have access to it. But it's something that we do at START a lot. My program, we build out a crisis plan. But the crisis plan it's like 10 pages long and it has this kind of elements and that kind of elements and it's kind of complicated. This is a way to really break that down and be collaborative with your child and help them figure out what kind of things make me feel upset. And what does that look like? When I'm feeling a little upset and I'm heating up, what do I look like? What does it look like when I'm starting to get pretty mad? And what does it look like when I'm feeling big, big, big feelings? And what can I do in those moments? What'll help me feel better? Um, and having this up in the house and coloring it, so we tend to have like that circle is the green. And then we would have small be yellow, medium be orange, and big be red. For whatever reasons, this is something that I've noticed. And again, I've been doing this for a long time. Sometimes you'll ask somebody with autism how they're feeling, and they'll say good because it's just like automated and they think that that's what you want to hear. And then if you ask them what color they're in, they'll say, oh, red. It's like, oh, okay, this is an emergency. And so I think really having this up on the wall and using the language of I'm in the green, yellow, orange, or red can be really, really helpful. And then if it's already listed out, okay, if I'm in the orange, what should I do? Okay, this is time for me to go and listen to music in my room and like kind of decompress from there. Usually when people are in the red, that's when I say like everything has to just stop and let things simmer down. So like turn down the lights. Try to make the temperature in this space as cool as possible. It's easier to do this time of year than in the summer. Turn off as much noise as possible. Like once someone's in the red, you kind of got to like minimize use of language and let them have their feelings. We really want to catch things in the yellow or in the orange. But what can I do if I'm in the yellow and I'm starting to feel a little bit upset? Maybe that's time to go talk to my mom or call a relative, talk about my feelings. Maybe that's time when I should listen to my favorite song or journal. If I'm in the medium, if in the orange, maybe that's time for me to do some deep breathing. So, you can always work on this with the school too, but I find that the language of a thermometer or an emotional thermometer can be really helpful. Take a break cards. I love these. It's a way for people to ask for a few minutes without having to say anything. So you can make these yourself at home. You can use just construction paper. You don't even have to write any words on it at all. And the great thing about take a break cards is in theory, anyone in the family can use it. So if your child is getting upset and they can say, I need a break. And you can set a timer. It doesn't have to be a 20-minute break. It can be a 2-minute break, a 5-minute break, depending on your family and your child. But it can also be used by you. It's for kids and parents to have an opportunity. So they, you would set it up and explain to them, if somebody needs a break, they're not in trouble, but they just need a minute to de-escalate. And so sometimes mommy or daddy needs a moment to de-escalate, and sometimes you need a moment, right? Everyone needs a break sometimes. But you can just hold up the card, right? And it's a visual cue. And maybe as part of it, okay, like time to set the timer, 2 minutes, 5 minutes. But we just need a break. And it's important too, because, again, we all lose our patience, right? Everyone is human. So if you recognize that you're about to lose your patience, you can just kind of like hold up that card. And then three great things. I really love this one. I used it a lot during the pandemic myself. Again, it's similar to what I was talking about earlier with those scheduled phone calls with schools to talk about what went right. This is something you can do at bedtime or at dinner time. But what are three things that happened today that were great? And again, it forces you then throughout the day to look for the good things. And it doesn't mean that things aren't happening to you that are upsetting or hurtful. But it's trying to increase that positivity ratio so that we're drowning out the negative with the positive.